Okay, Congress will vote on the GOP health care bill. Joining us now, former New York Lieutenant Governor Betsy McCaughey, from Washington, Topher Spiro, Vice President of Health Policy at the Center for American Progress. Betsy, start with you. I mean,
this is a big day. I believe we have the votes.
That's what I mean. But are you just being optimistic and positive with the company line, or do you have reason to believe?
No, it appears that late last night the holdouts in the House appeared to have reached a deal directly with the president, a deal that will lower premiums even more. And let me just point out, since I've heard this term so often in the last few days, this bill is not Obamacare light. It repeals the individual mandate, which provides relief for 8 million people currently incurring those penalties. It repeals the employer mandate, which has cost millions of people their full-time jobs or employment in general because employers found it too costly. It reforms Medicaid. The nation is facing a tidal wave of red ink because of Medicaid. And it's going to provide relief for people in the individual market who can pick the kind of plan they want.
But the specific agreement, and this is what the market's going to be watching so closely, will bring them back in, this deal that was cut last night, because it does two things.
It does two things. It removes the, quote, one-size-fits-all government-designed essential benefit package so that the 30-year-old single guy doesn't have to pay for pediatric dental care, right? And it also changes the insurance rules to give a break to healthy people buying in the individual market. The sick will not be forgotten, however. They will be heavily subsidized through Section 2202 with taxpayer dollars to make sure they get the care they need affordably as well.
All right, Topher, we had a Democratic congressman on from Kentucky yesterday, and you know, I knew what his take on this was going to be, but when it was all said and done, it was like, you guys are kind of, the Democrats are sort of just watching on the outside looking in here. Does it? I know you're just going to say this is the worst bill ever, and you know that grandma's going over the cliff and everything else. But does it really matter? I mean, this is in the Republicans' hands right now, isn't it? Whether it goes or not.
Well, Democrats are pumped up. But first, let me address the elephant in the room, because you're having me on with someone who spread lies about death panels in the Affordable Care Act. PolitiFact said it was the lie of the year. And what's ironic is that actually what's true now is that you're seeing the death panels, and the death panels are the Republican committees that are advancing this bill that would throw 24 million people off coverage. People would not be able to get the life-saving care that they need, and that's why every single doctor group, every single nursing group, every single group that cares about patients hates and opposes this dumpster fire of a bill.
What drivel? Let's go back to the facts. First of all, the American Medical Association opposes this bill. That's only 12% of the doctors in the country. Many, many other doctors' organizations are demanding that we pass this reform because Obamacare has so come between doctors and patients that when you go to see a doctor, you can't even get eye contact anymore. The doctor is spending all his time or her time typing into a computer what the government demands to know about this patient. So this will provide urgently needed relief for doctors and patients in that office. Get Washington out of that office.
Pediatricians oppose this bill. Family physicians oppose this bill. There's not a single physician group that does not oppose this bill.
Well, there were a lot of, you know, back when Obamacare was written, there were a lot of Faustian deals made all over the place with different groups. And the one thing you can't dispute is that it never got above 42%. After 7 years and, you know, all the selling and all the, you know, you had a president in office that passed it trying to get people to say this, you know, take your medicine, this is good for you. And you can just look at the chart. Never got a plurality of people that actually approved of it. And it turned out it was more unpopular with people that actually had experienced it than people that hadn't experienced it. You don't think anything should have been done to try to fix you know, what Obamacare turned into?
Well, actually, that's not true. Right now, the polling is very favorable for the Affordable Care Act.
That's the first time. It's been 7 years.
Yeah, but it's
I'll show you the line.
But it's consistent now.
It's always been more unpopular than popular for the entire until now.
But now it's very popular. People don't like it when you try to take something away.
Well, yeah.
And now what's really unpopular now?
It's hard to bring back an entitlement.
Fox News came out with a poll that showed that only 34% support this Republican bill.
That's because they haven't heard the truth about it.
People disapprove of Trump's handling of health care. Only 33% approve of Trump's handling of health care. This is bringing down his approval rating.
Let me tell you one thing.
And it's a total political dumpster fire.
Americans don't like the fact that their premiums have doubled since the end of 2013. Americans don't like the government forcing them to buy a product or pay a penalty. In this country, if people don't want to buy a product, you improve the product. You don't fine them for not buying it.
Well, you don't fine them like the Republican bill does when they try to buy insurance. That's keeping people out of the market. We want people in the market. We want people to have insurance. And what the Republican bill would do, independent analysts have said this, the CBO, the Congressional Budget Office, it would increase premiums by 15 to 20% next year.
Only until the Obamacare regulations are wiped out. Then premiums
insurers would
go
start
down.
to withdraw from the market almost immediately. Premium increases almost immediately.
Topher,
I don't know why.
like there are some
I don't know why
changes.
Trump. I don't know why Trump is going forward with this.
Let me point out,
it's a total political disaster.
The CBO says that people will withdraw from the market. Once there is no mandate, people will exercise their freedom to choose whether to buy Obamacare or not, and they will choose not to. And then in 2020, there will be new plans available of all sorts, and people will exercise their freedom to choose to buy what they want. Yes, the CBO says that 14 million people who currently are being forced to buy Obamacare will choose not to buy it. That's freedom. That's the free market. That's what we stand for in this country, freedom.
No, well, you're being misleading because 5 million of those 14 million are on Medicaid, and Medicaid cuts are going to throw them off coverage. And out of the rest, some of those people who are losing coverage is because you're sending the market into a death spiral. So you're increasing premiums. It's not about that they have the freedom not to have insurance anymore. You're increasing their premiums.
No, the fact is they will still have the subsidies.
That's what the CBO said.
No, you are incorrect about the CBO report, which I've read very carefully.
Did you read it?
Yes, of course I did. And the fact is the CBO made it clear the subsidies will be available. People will not be asked to pay a larger share of their income, but they will choose not to buy Obamacare because it is a defective system. When the new plans come in, people will have the freedom to choose what they want. There is no reason for a 30-year-old single man to pay for maternity care. No reason at all. Let people buy what they want.
No, what they said about the new system is that actually it would price older people out of the market.
Although, Topher, I know what you're talking about on the CBO. They've altered the bill since that CBO scoring
They
came
certainly
out on that
have.
in particular.
No, we actually did an analysis of the altered bill, and
Betsy
we found that
was talking about an additional alteration that was taking place last night.
Well, even with the $85 billion reserve fund, which is just really just a magic asterisk, a promise to increase tax credits for older people later, we analyzed that. We found that it would still increase costs for older people by $8,000. So that's not a good deal. And the other thing is,
Section
it would
2202.
also water down people's coverage. It would make you have skimpier coverage. So actually, the Kaiser Family Foundation,
only if you choose a lighter policy. No one's going to be forced into skimpier care, but nobody should have to buy a policy with a lot of bells and whistles they don't want. They should have the freedom to buy affordable health care. And by the way, with these changes, employers, especially in retail, for example, and hospitality and the food service industry, who start providing coverage for their employees, will have the freedom now to go back and provide coverage for those people without a one-size-fits-all government design plan that was too expensive for employers.
How are people going to have the freedom to keep their plans when you're slashing their tax credits? I mean, there's no freedom. Kaiser Family Foundation found that the average deductibles would increase by $1,500.
I think
Trump promised to lower deductibles.
With
Trump promised to lower
amendments to
deductibles. This bill is increasing deductibles.
Now, premiums are going to come way down because of the changes in this bill last night.
All right, Betsy, thank you. Topher, thank you. We'll know by tomorrow.
Still a lot of moving parts, it sounds like, too.
Yep. And then there's